Okay, so I will post the recording of this workshop on a link on my Instagram, and I'll also send it out if anyone's interested after the fact, so you don't have to worry about taking notes during the workshop. Let me just see how many people we have so far. All right. Maybe I'll just preamble as we wait for a few more. So as I mentioned, my name is Emily. I run the Instagram page at EG MedPrep. The other name on this slide is my husband's name, Dr. Ariel Gershon. He kind of appears in this presentation in video form. We used to do this together, and now I kind of run it. But you'll kind of see him pop up in a video a bit later on. This workshop is intended for anyone who is anticipating that they might be interviewing for either medicine or dentistry, or really almost anything, but it's mostly focused on those two in the near future. Yeah, so maybe we'll just get started. Let's see, just check the numbers again. Right, yeah, we can get started. Okay. Okay, so basically what I'm going to cover in this presentation is we're going to talk about some goals and styles of interviews. I had a lot of questions about like MMI versus panel, other styles of interviews. Really, they're all kind of similar, but we'll talk about that. We'll talk about different styles of questions and how to prepare your responses to them and how to prepare for interviews in general. We'll do some examples and review different types of structures for answering different types of questions. Then I have a review of red flags. And then at the end, there's time for a question and answer period. So if you have any questions about anything interview related, you can definitely ask that either by unmuting yourself or just posting it in the chat when we get to that point. I know a lot of you left questions in the sign up form for this workshop. So I also have some of the kind of the most frequently asked questions ready to be answered if they don't get covered throughout the presentation. Okay, so just to let you know a bit about us, usually, as I mentioned, my husband Ariel kind of joins in this presentation. Maybe I can kind of use this slide, which is about him, to tell you a bit about how I got into this area of work in the first place. So Ariel, my husband, applied to medical school back in 2015, I want to say. Does that track? Sounds about right. And at the time, I was studying English at the University of Toronto, and he was studying different science specialties, or he was a pathobiology specialist at U of T. And I really enjoyed being able to apply my knowledge of English and communication to helping with the interview and helping with applications for both him and his friends who were also applying. That's kind of where it all started. Then I started doing it just for fun as kind of a side gig. And then around 2020, I made this kind of my full-time job. So I've been doing editing and interview prep for med students and dental students, mostly kind of since then. So this is kind of my About Me page. I have my background's in English and creative writing. As I mentioned, I have an MA in creative writing from U of T. I've also been a community member interview panelist at a med school in the past. I'm not going to say which one, but maybe I'll tell you later if you ask nicely. And in terms of like my stats for interview prep or interview related things, these are my stats from just OMSAS applicants last year. So I had like, I think there's 40-ish, maybe a bit less students who applied through OMSAS to med school last year that I worked with, and this is how many were accepted. Most of my waitlist people ended up getting off the waitlist. I don't think the low waitlist person did. That's a hard gig to get off of. Anyway, so this doesn't include the people I've worked with who applied to out of province schools or out of country schools. Most of my students tend to be from Ontario, but I also have experience working with students who are applying to, BC or Alberta or Dalhousie and other provinces as well. And also this doesn't include dental students. I usually have fewer of them. So those stats are kind of separate, but this is kind of a representation of how I normally do or how my students normally do when it comes to interviews. Okay, so all of that are reasons why you should trust me and you should listen to the advice I'm about to give you. But as always, there is a disclaimer and there are some reasons you should not listen to me. And one of those reasons is that there are always exceptions to the rules. I have pretty strong ideas about what I like in interview answers and what I don't like, mostly because I've heard a lot of interview answers and I kind of understand what's cliche. But also just because something is cliche to me, that doesn't necessarily mean it's going to be cliche to your interviewer. I have heard far more answers than your actual interviewer has probably heard. And, something that sounds cliche to me might sound fresh to them. So I'm just one person. I represent only my own opinions. There's always subjectivity involved, something that I might like, someone else might not. Also, very importantly, I don't represent any school's admissions committee. The gold standard is always to check with the school. So if you have questions about like how long you have to think on an MMI or how long a station is, or like what's going to be covered on an interview, the best thing you can do is actually email the school's admissions committee and just ask your questions there if it's anything to do with format of the interview or anything like that, dates, that sort of thing. Okay. So I have some slides now that are just kind of like general information stuff that I'm going to go through pretty quickly. What I do want to draw your attention to on this page is the CanMEDS framework in the corner there. This actually, I think, has changed over the years, and it might be different qualities now or different ways of phrasing them. But all of the medical schools in Canada kind of refer back to these qualities as things that they're looking for in applicants. They want someone who's professional, who's a communicator, collaborator, manager, health advocate, scholar. And we're going to get back to this later on, but it's something to keep in mind and to review if you're applying to med before your interview, or just to kind of understand. For dental students, there is also kind of like a dental competency similar to the CanMed rules. Basically, it's kind of the same stuff: professionalism, communication, collaboration, things that are kind of common sense that you would need to have if you're in kind of a healthcare role. Okay, so I'm going to talk very briefly about like MMI versus panel interview. By very briefly, I mean there are lots of different ways schools can organize their interviews. Usually a panel, I'm going to actually skip through this. Usually a panel interview is you sitting in front of, either virtually or in person, maybe 3 or 4 people. They ask you a bunch of questions in a row. You don't have any time to think beforehand, although you can ask for a minute to think if you want to. And it's more kind of conversational. You go back and forth with their list of questions. And in MMI, you will sit down, you will get a question in front of you, either at the door if it's in person or on your screen if it's virtual. You read the question, you have an amount of time to think about your answer, usually around 2 minutes. Then you go into the real room or virtual room and you discuss your answer with the interviewer in that room, and then you move on to the next room and another question. Really, the only difference between MMI and panel in terms of how you prepare is timing. So if it's an MMI, you will know I have 4 minutes to answer this question, or I have 6 minutes to answer this question, whatever the timing is. Whereas in panel, the timing is more lax, and you might have spent like 3 minutes on one question and 4 on another, 2 on one question. It just kind of depends on what the question requires of you. So there's no strict time limit with panel interviews. The way you prepare for them is exactly the same. You can get the exact same type of questions on panel interviews and MMI interviews. You can get ethics and personal questions on a panel interview. You can get ethics, personal, all types of questions on an MMI interview. I think one myth that kind of gets circulated is that there aren't any personal questions in MMI interviews and panel is all personal. That is not true. It's a good mix of everything in both types. So that kind of brings me to this slide that I have about myths about interviews in different formats in general. Kind of covered the first one. I'm going to skip down to the bottom one and maybe leave the middle for last. So another myth that I think some people hold, or at least an attitude they take towards interviewing, is that they assume the interview, if it's open file, will know your CV in detail. I would say even if you are having an open file interview, you still want to explain in detail your activities and what it is that you've done, and not assume that your interviewer knows everything. Even if they have your CV in front of them, they may not have had time to actually read it. And if I would much rather you repeat something on your CV than leave it out. So it's definitely worth going over material more than once, even if you think they might know it already. And then that middle point there, just be yourself, is another myth, especially when it comes to medical and dental interviews. You can get away with that maybe at a job interview or something more casual. The medical and dental school interviews are very structured. And really, if you go in with the attitude of like, I don't need to prepare, I can just go in and be myself, not going to work out too well. People are preparing really hard for these interviews, and there is a lot that you need to think about and understand and practice before you go in to present the best version of yourself. So I'm not saying don't be yourself, but don't just be yourself. You want to be a heightened version of yourself, the best version of yourself, and kind of bring forward the qualities that you know will help you secure a seat in your desired school. Okay, so now I'm going to get into what an interview should accomplish, or what you should hope your interview will do for you. So number one, your interview should prove, using concrete examples from your CV or ABS or resume why you would be suited for the role of either a doctor or a dental student or a medical student. This is what every answer that you give in the interview should do. This is the point of the interview. So if you are giving me an answer in an interview setting or in a practice setting that doesn't do this, then you're not using your time wisely. Everything you ever say in the interview should be in service of this point. This is like the most important thing to know about interviewing in general. Other secondary points, it should also set you apart from other candidates, and you should be able to show yourself as someone who is uniquely qualified for the position, someone who they want to have on their team or in their school. It's also a red flag check to make sure that you aren't problematic, and also kind of a vibe check to make sure that you kind of mesh well with the school and you're nice to work with and you have a good attitude relative to, other students and schools. So really that first point is kind of the most important thing when it comes to interviews. Okay, so I have kind of broken down interview questions into different types that you can expect to see in any given type of interview. And I've divided them based on the approach that works best for each category. So the first two are kind of the most common. We have personal behavioral questions. These are questions about you or questions that ask you to recount some experience that you've had. So questions like, tell me about a time you worked on a team, or what's your greatest weakness? We also have ethics and policy questions. These are questions like, would you be in favor of Canada moving to a privatized model of healthcare? Why or why not? These two are like the main two types of questions you're going to see. There are also standard questions, which are really just two questions. Tell me about yourself and why medicine or why dentistry. And then I have seemingly impersonal or unconventional questions. If you could be any flavor of ice cream, which flavor would you be? These are basically personal questions in disguise, which we can talk about a little bit. But it kind of like ties back to the first method of answering questions. And then there are like acting and task-based stations, which are rare within medical school and dental school interviews. McGill historically has been entirely acting. And I think one task-based station, like the whole MMI, is only acting. I think UBC might have an acting station in their MMI or has historically. Most of the Ontario interviews do not have an acting station. McMaster might, but most of them don't. So if you have a school that has done acting or task-based stations in the past, there is a way to prepare for that, but it's much more difficult to prepare for acting stations than all of the other types. So focus should mainly be on kind of the first two main types of questions, which is what we're going to work on right now. So I'm going to start with, I do have approaches for both of these types of questions, or kind of frameworks that you can use to help yourself prepare. And I find it's easiest to talk about those methods for preparing with an actual question or with an example. Otherwise, everything kind of gets kind of abstract and vague. So I'm going to put up on the next slide an example of a personal or behavioral question. And I'm going to read it to you and have you think about it for a moment. So the question is, what is one quality that you think is essential for a physician to have? Do you have that quality? So I'm just going to pause for a minute, let you think about what your answer to this question might be. And after we wait a moment, I'm going to actually show you a video of my husband answering this question that I basically wrote out a script for him to say that I think is like perhaps mediocre or not the best interview answer. And then I want to know what you guys think of it. And I'm going to have you kind of like play interviewer and evaluate that answer. So a moment to think of how you would answer it. Okay, so I'm going to go on to the next slide. I am going to play this video of my husband Ariel answering this question. I think he was like kind of sick when he recorded this video, so ignore his cold voice. But yeah, you can listen to it and also let me know if the audio is working. Hold on. Oops. Back.
So one quality I think that every physician should have is empathy. While it's necessary for doctors to be medical experts and to effectively treat diseases, doctors are also treating the patients who have those diseases. Patients in the hospital or clinical setting might be anxious about procedures, or they may be worried about the outcomes. So for that reason, it's important to be able to, for doctors to be able to put themselves in their patient's shoes and to provide emotional support in addition to medical support. So yes, I do believe I have this quality. to answer your question. I have been involved in a number of different extracurriculars which have called upon my empathetic communication skills. I currently volunteer for the Toronto Community Crisis Line, for example. I also serve as a peer mentor through a program called Altitude Mentorship at my university. And through these experiences, I've been able to provide empathy and compassion to people in need. Thank you for asking me this really interesting question.
All right, so I am going to explain to you all a grading system that may or may not be used at a med school that is used to evaluate interview answers. And then I want you to grade Ariel's answer on that scale just by kind of posting a number in the chat. So it's a 1 to 5 scale. 1 is the low end. 1 means he or you said something that was a red flag, something really bad, we don't like it, answer gets thrown out. 2 is an incomplete answer. It means he didn't say anything awful. It just wasn't as full as we were hoping for. It needs more information. 3 is where most people end up. It means you answered the question, good job, meets expectations. 4, above and beyond. So you answered the question, plus you gave us something extra that most other applicants didn't. Very, very strong answer. And 5 is reserved for the most special, most unique answers. Very rare to get. What number grade would you give Ariel's answer? You can just post it in the chat and we'll kind of see what average score he gets. Just open this up. I'm getting 2s and 3s, lots of 2s and 3s. That's about right. I would give this, I think this is a solid 3 for me, maybe a 2.5, somewhere between 2.5 and a 3. And also, as you can see, kind of different people have different interpretations. Like there are some 2s and some 3s. This is how panel interviews work too. So maybe one panelist might give him a 3, another one might give him a 2, and then it kind of gets averaged out at the end. Something to know. Okay. So now that you've graded his answer, what do you think he could have done to make this answer stronger or to get it from a 2.5 to a 4 or a 5? You can unmute yourself or you can post in the chat. Someone said, stick to one example and elaborate. Absolutely. I love that point. Lots of elaborate on a story. Love that. Connect to a personal story, a more detailed example. Yeah, absolutely. So the main issue in this answer is that he gave kind of a list of different experiences that allowed him to practice empathy or allowed him to develop his empathy skills. But I didn't get a specific story that shows him being empathetic or proves that he's empathetic. And really, if we think of the point of the interview is being to prove that you have the skills that the med school is looking for, empathy is a great skill or quality to show. But I don't know that this person or that Ariel in this case is empathetic. I just know that he's been in positions that require empathy before. So I need a more detailed story that actually serves as proof. One other thing I want to mention is this question is always the first question I pose to students when I do like an intro session with them or when we start our interview prep sessions. And there's a reason I make this the first question. And it's because it's so open-ended that almost any quality could work here. However, about 85% of the students I ask this to, whether it's dentistry or medicine, will say empathy as their quality. And just maybe by a show of hands, when you had a moment to think about your answer to this question, put your hand up if you thought of empathy as your quality. Yeah, fair. And I think empathy is a good quality, and it totally makes sense that that would be a thing that you would think about for, you know, an essential quality for a physician or for a dentist. However, the reason 95% of people choose it is because they're thinking first of the quality and then of their experiences, when really the fact that this is an open-ended question means that this is an opportunity for you to bring your best story forward, which we'll talk about in a minute. I will introduce star stories, or your best experience forward, anything that you want to talk about with the interviewer. And if you pick empathy, it might be because you have a story about empathy that's really relevant or strong, but it might just be because that's the first quality you thought of, when really what you should be thinking is, what is my best story and what quality do I display in that story, and make that your quality. We'll talk about that in a moment. Okay, so I kind of briefly mentioned star stories there. Star is a way of telling a story that makes it really easy for your interviewer to follow and also proves that you have qualities that the med school or dental school might be looking for. So the situation is the basics of who, what, when, and where, kind of like the context for your story. Ariel mentioned in that video that he was like a peer help line volunteer. So the situation for a story like that might be, in my 3rd year of university, I began volunteering for Kids Help Phone, And in that role, I was responsible for providing tech support to children and underage people within Canada who were experiencing mental health crises and looking for support, something like that. Task is what was your specific goal within the story. And I want the task to be as specific as you can possibly make it. So I saw a lot of comments on Ariel's response saying we need more specific story. So if you were to talk about everything you ever did in this chat helpline position and every person you ever spoke to, and say like generally I would provide support by being really empathetic, listening, offering advice, that would be too vague. So I want you, or Ariel in this case, to think about just one person that they helped and how you were able to be empathetic with that person. So maybe it would be something like, on one occasion, I had a young person call into our helpline who was really struggling with anxiety and looking for ways to cope. And it was my job in that situation to be able to offer support and guidance to that person, who I will call Jeff. Make up a name for them. Okay. Action is, what did you do and how did you do it? This should be the biggest part of your STAR story. So like 50% action, 50% divided up between the other letters. And if we're talking about empathy as the quality, I want to know, how did you empathize? And that should kind of be the focus of your action section. So saying things like, the first thing I did when Jeff called and I answered the phone was I introduced myself and I asked some open-ended questions. How are you feeling right now? What can I do to help you? What are you hoping to get out of this phone call? And by starting in an open way and letting Jeff lead the conversation, I was able to learn more about his perspective and his feelings and how I could best help him. Once I, left the floor open to Jeff, he let me know that he was struggling with anxiety as it relates to test taking and school, and he was feeling a lot of pressure from his parents to do well, and he wasn't sure he could live up to their expectations. I was able to then validate Jeff's feelings and let him know that that was totally understandable to feel overwhelmed, especially when he was faced with so many different responsibilities. I also asked him what he normally did to cope with anxiety when these feelings came up for him in the past. Jeff let me know that running was something that really helped him. And I was then asked him if he would be able to run again, or if that was something he could do now. And in having this conversation, I could tell that Jeff started opening up to me a bit more. One thing that was really important for me to do during this conversation was actually put myself in Jeff's position and imagine what it would be like to feel overwhelmed and like I didn't have any support and that I couldn't even turn to my parents, who might be a strong support system, because of a fractured relationship. And I imagine that would feel very isolating. It would feel like I was alone in trying to achieve my goals. It would feel perhaps very scary. And by understanding those feelings and taking the time to internalize them, I was better able to relate to Jeff and help him navigate this problem from an empathetic perspective, something like that. You could also add like other action items here about, how you communicated with Jeff or how you communicated in an empathetic way, but that's kind of like what we're looking for and the level of detail that we're looking for. The result is, what was the outcome here? So after speaking with Jeff for about 10 minutes on the phone, I could tell that his voice started to become more calm and that he was more even keel in the way that he was conversing with me. By the end of the conversation, he let me know that he felt really comfortable talking to me and he was happy that together we'd been able to brainstorm a few strategies that could help him reduce his anxiety. I also referred him to some resources in his community, something like that. After the STAR story, I also like to include, what did you learn from the experience about the quality at hand? So in this case, about empathy. Something like, from this experience, I learned when I'm working with people who are vulnerable or going through a difficult situation, it's really important that I take the time to listen to them actively and understand their perspective. And also that I'm able to really internalize how they're feeling so that I can best respond to them in a way that they will be receptive to. And then you're going to talk about how you can use these transferable skills in a medical or dental context, depending on your interview. Something like, as a future doctor, I will be responsible for helping patients navigate very difficult or vulnerable medical situations and decisions. And it will be really important that I'm able to empathize with their feelings and their circumstances so that I can provide the best possible care and make sure that they feel comfortable sharing vulnerable information with me. Something like that. Okay, any questions about STAR method or like this kind of framework? You can type in the chat or unmute. Okay, gonna move on. Okay, so you might be thinking, There are infinite questions that might come up in an interview. How can I prepare for every single question? That's a good question. So you might not know what questions will be asked of you in the interview. In fact, you won't know, and all questions are kind of fair game. However, you do know what qualities you will be asked to demonstrate in the interview, because the admissions committee is not going to ask you to demonstrate a quality that's not relevant to either medicine or dentistry. They won't say, like, can you prove to me that you were a good basketball player? Tell me about a time you played basketball, because that's not relevant to medicine. The CanMed roles, as we mentioned earlier, and also those dental competencies, are qualities that are relevant to your desired profession. Also, there are qualities that aren't necessarily CanMed roles, but also very related to either medicine or dentistry. So basically, any quality you could have answered that first question with, empathy, not a CanMed role, but something a lot of you thought of, that definitely makes sense for a med interview. Things like time management, not a CanMed role, but also relevant. Any quality that you think is important for a doctor or dentist to have should be a story that you prepare a star story for, or quality that you prepare a star story for. So what I encourage my students to do is create a spreadsheet that looks something like this. And in the first column, you can put in your activity. In the second one, a quality that your story demonstrates, and then a very specific situation, task, action, and result, lesson in connection to either medicine or dentistry, that you can like have on hand to refer back to. You don't have to be so detailed in writing these answers up, but just something that kind of cues you to know what your stories are. So you should have a story for empathy. You should have a story for communication, for collaboration, for leadership, for advocacy, for time management, for conflict resolution. And if you have like 8 to 10 of these star stories prepared and workshopped, you can answer any personal interview question that's thrown at you. So that story that we just did about empathy and helping Jeff navigate his anxiety, we use that for empathy, or for the question about what is one quality that a physician should have. But what if the question was something like, tell me about a time that you had to communicate with someone who is different from you? We can use that exact same story, but just emphasize different parts of it to make the story fit. So you can say, I worked for Kids Help Phone and I communicated with someone who I will call Jeff. I am, in my mid-20s, and I haven't been a kid in a long time. Jeff was 10 years old, and he was, in that way, we were different. He hadn't experienced as much life as I had. We came from different perspectives, but I was able to relate to him and then give me almost the same answer, but how you communicated with him. So it's just which parts of your already prepared star stories are you going to emphasize to make them fit the question that is in front of you. Cool. Any questions about that? Okay, and move on to the next slide. Okay, here are some like common mistakes that I see people make when answering personal questions. Number one, a lack of detail in the action section of the star story. We kind of talked about that in depth previously. Being negative about yourself or others, this is a big one. One rule I have for interviews is do not be negative unless the question is asking you to be negative. Meaning if the question is something like, tell me about a time that you failed, or tell me about a time you navigated a conflict, within those answers, you are allowed to say something negative. You're allowed to say, I failed, because that's what the question is asking for. If the question is not asking you to be negative, if the question just says, tell me about a time you worked on a team, don't tell me about a time you worked on a team and you didn't work well together. Make it entirely positive. Tell me about a time you did work well together and what you learned from that teamwork experience, and how you're going to take those lessons forward with you as you join other teams and contribute to other collaborative situations. So be entirely positive unless you are asked to be negative. Always connect to medicine at the end, or dentistry if you're a dental applicant. Don't pick a story that's too big for the question. This is kind of a specific one, but you want your task and story to be very, very narrow. Don't talk about every person you ever spoke with on the helpline. Pick one person. If it's a teaching experience, one student who you taught. If it's a leadership experience, one event that you ran. As specific as you can be. Don't speak too quickly. Your pace should be pretty even keel. I get a lot of questions about like, what is the tone that I should have for the interview? And my answer is always that you should imagine that you are already a doctor or a dentist and that you're speaking to a patient. So you want to be friendly and familiar and approachable, but you also need to be professional. And kind of the same thing goes for like, how much personal information do you want to reveal in the interview? If you wouldn't say it to a patient, then you probably shouldn't say it in the interview. So you're going to be open and communicative and detailed, but also professional in your tone. And if you're speaking too quickly, it's going to be hard to understand you. Pay attention to the reason the question is being asked. The reason is always to prove that you would be a good doctor. So if the question is something like, tell me about a time that or what's your greatest weakness? The reason the question is being asked is to understand how you are able to overcome your weaknesses and promote self-growth, and not just to talk about a weakness in and of itself. So kind of like use questions to show the best parts of yourself. Don't blame other people. This is a big one, especially in conflict questions. Huge red flag. Never ever do this. You always take responsibility for anything that's gone wrong, and make sure that if it sounds like you might be blaming someone else, that you give them the benefit of the doubt completely and talk about all the reasons why they were actually in the right to do the thing that they did. Using we instead of I. Some people use we instead of I because it's hard to talk about yourself so positively in the first person for hours on end in the interview setting. It's kind of a way to like deflect from how uncomfortable that is. Try not to do that. Take credit for your accomplishments and say I. The word but, I mean, in a specific way here. So sometimes people will say things like, I really like research, but I wanted to focus more on clinical medicine. And you don't have to like minimize your past accomplishments that aren't medical by using the word but in between two things. You can say, I'm really interested in research, and I hope to use the lessons that I've gained from my research experiences as I transition into becoming a clinician scientist or as I work with patients, something like that. And also always center your own accomplishments. You've done a lot of work to get to this point, and this is your chance to show it off. Okay. I do want to check the time quickly. What time is it? Cool, we're about halfway through. Okay, so I also want to briefly touch on unconventional or seemingly impersonal questions, which are actually just personal questions in disguise. So anytime a question is not an ethics question, which we're going to talk about, and is kind of like a broad question like this one, what do you think is the most important medical invention in the last 100 years? That is an opportunity for you to talk about yourself. Every interview question serves the same purpose. You should use it to prove that you belong in a medical school or you belong in a dental school. And if you were to answer this question and say something like, I think a stethoscope is the most important invention. It's a way for us to hear people's hearts. And we weren't able to diagnose all these diseases before we had a stethoscope. I wouldn't learn anything about you other than you know what a stethoscope is. The better way to approach questions like this is in your 2 minutes to think if it's an MMI, or in your moments to think if it's a panel interview, think about which of your 8 to 10 star stories that you've already prepared could you possibly insert into this question. And maybe you've done research that uses an MRI, or maybe you are actually working on a novel medical device, or maybe you are really interested in mental health and that's something that's important to you and you've done a lot of work in. And maybe you want to say like the most important medical invention is, talk therapy. And that's something that you've been able to do in your role as a peer counselor or something like that. And you can basically choose anything as the medical invention and find a way to connect it to you. So the way to answer to this question would be something like, I think the most important medical invention is insert any invention. I think it's important because, back it up, talk about why it's actually important. And then you could say, I've actually been able to see this device or invention be put to really good use in my experience as a research assistant. I work for whatever name of organization, and I work directly with MRIs, and I've been able to participate in experiments that involve A, B, and C. And then you can use it to talk about yourself as a researcher or as a support person or whatever it is. So always connect to yourself and think about ways to make these kind of unconventional questions actually about you. Okay, I have a slide on tell me about yourself, which is a very broad question. I'm not going to go into too much depth. I do see a comment in the chat. What if it's one of those questions you brought up earlier, like if you could be an ice cream flavor? Same thing. So think about a star story and then try to relate it to literally any ice cream flavor in the world. Maybe you have a star story about being a strong collaborator. So pick an ice cream flavor that you can somehow metaphorically relate to collaboration. I think I would be rainbow sherbet. What I really appreciate about rainbow sherbet is how you have 3 distinct flavors working well together, kind of in harmony. And I feel like each flavor kind of lifts the other flavors up. And that's something I also really appreciate and that I also put into use when I work on a team. I enjoy working with other people. And then give me your collaboration story or whatever metaphorically you want to relate to ice cream. Okay, cool. All right, so tell me about yourself is a big question. I feel like it doesn't come up as often as you would think in Canadian med school interviews, but it's still something that you should have an answer to, because if you get asked this question and you're kind of stumped, it doesn't look so good. And also this is usually, if it's going to come up, it will be the first question and you want to make a good first impression. So it's still worth creating a tell me about yourself answer. Um, I have some like do's and don'ts for tell me about yourself. I have a general structure for this. Generally, what I like to do is like briefly introduce yourself, introduce some skills and qualities that you have, and then kind of tease some star stories, just kind of the situation and the result, and then briefly mention what you like to do for fun. And you want to always bring it back to medicine or dentistry. So you don't want to like answer a tell me about yourself and not mention medicine at all if you're in a medical school interview. That's kind of generally my structure. But there's definitely leeway with this, and you can play around and have different structures, and lots of them are great. I do have some things that I don't like in a tell me about yourself or a why medicine or why dentistry. And one of those is telling a story about your mom, sister, father, uncle, or grandma who had a disease or health condition. And that's how you knew you wanted to do medicine or dentistry. It's cliche, it's been done a million times, and it doesn't tell me anything about you. Lots of people, in fact, everybody almost in the world has had a relative who's been sick or been in the hospital. And not everybody wants to be a doctor. And more importantly, not everyone would be a good doctor. So there are some cases where you could use this, and I think it wouldn't be the worst. But if you're going to bring up a story like this, you have to use it to showcase what makes you different from everybody else in the world who's had a relative who's been in the hospital. What did you learn from that experience? What skills did you gain that you think would make you a good doctor? You don't have to tell your life story in chronological order. In fact, I wouldn't. And I wouldn't reach too far back in the past. You don't want to start with, when you were born or when you were 3 years old. Kind of stay undergrad and beyond. Okay. You can ask me more questions about this in the Q&A at the end. I'm sure there are lots of questions about tell me about yourself and why medicine. I could talk about this forever, so I'm going to go on to the next slide. But if you have more questions, you can ask afterwards. Okay. Oh, sorry. There's a note here about things they're not allowed to ask you about. And if an interviewer asked you about any of these things, you are allowed to say, I don't want to answer this question, just for you to know. Good information. Cool. Okay, so I'm going to move on now to ethics and policy questions. I have a sample. We're going to do the same thing. So I have a sample question up here, and then you're going to see Ariel answer the question, and you can kind of give him a grade on it, and we'll talk about it. I'll read the question to you because it's kind of hard to read as I'm talking. So the question is, East Vancouver is home to Sugar Mountain, a tent city on which hundreds of homeless individuals live in tents and makeshift homes. In November of 2017, Vancouver firefighters raided the tent city, removing stoves and heating devices from tents. In a press release, the city argued that fuel-powered appliances present a significant hazard when used inside enclosed fabric spaces, yet the raid left hundreds of people without any means of cooking or staying warm. Do you think the fire department was justified in the raid? So I'm going to let you think about your answer to this question for a moment and how you would answer it, and then we'll go on to the next slide. Okay, here we go. Ariel's answer.
Yeah, so this is a really interesting and difficult scenario. On the one hand, I understand that the firefighters, in their perspective, is that it's important for them, the firefighters, to make sure that they're preventing fires in this area. But on the other hand, I'm seeing the perspective of the homeless population, and it's important for them to have access to heat and a way to cook their food. It can get very cold in the winter in Vancouver, and the raid probably left many homeless people susceptible to hypothermia, which is not a good thing. So I don't think that the raid is justified because the raid left this already vulnerable population in a really difficult and dangerous situation. Uh, Additionally, I think more could have been done to preserve the homeless population's dignity and well-being. For example, they could have been given a warning before the raid to make this intervention less combative. Um, and so that's my answer. I think it was not justified.
Okay, so opening it up to you guys in the chat, on our 1 to 5 scale, what number grade would you give Ariel for this answer? Saying 3.5s, 3s, a 1. I don't think it's a 1. 2 to 3, 3. Yeah, I'm kind of agreeing with the 2.5, 2 to 3. What do you think Ariel could have done to make this stronger? You can comment in the chat or unmute yourself. Yeah, so I have a comment, did not look at pros and cons of both perspectives, just through one lens. Absolutely. Yeah. give alternate options. Absolutely. I agree with that as well. Yeah, look at both sides. So the biggest issue, as you guys have identified in this answer, is that it's too one-sided, and Ariel did not adequately look at both sides of this issue or give any pros to the raid, even though he kind of settled on one side. So I have a structure that I like to use for ethics questions like this that I'm going to show you in a minute. Actually, I'll put it up right now.
Yeah.
Okay, so this is my structure for any kind of ethics question that has two options, either kind of an either or question. Do you agree with the raid? Yes or no? Why or why not? Would you tell this patient's parents? Yes or no? Why or why not? Do you agree with the policy? Yes or no? Why or why not? So this structure only works for when you have two options that are kind of presented to you that you have to choose between. I do have another structure for kind of how or what questions like, how would you approach your friend? What would you do in this case? That's slightly different, but it's based on the structure. So I like to go through this one first and kind of have you understand this one before I go on to the next one. The way the structure works is the first step is a plan layout. That means you explain the structure to your interviewer because they don't know what it is. I made it up. And because it shows that you know where you're going, and it also stops your interviewer from cutting you off before you're finished because they know what your last step is. It's a lot easier to follow what you're doing when I know what it is that you're doing beforehand. So that would sound something like, in order to answer this question, first I would like to discuss my values and how they align with this raid that happened in 2017. Then I would like to talk about some pros and cons of the raid, and then why I don't think the raid was justified, but what I think, and also what I think could have been done differently to protect the homeless people in this situation, or to mitigate some of the negative effects here. Something like that. Okay, within that structure or within that plan layout, the next step is value statements. So every ethics question that is kind of laid out this way is an ethical dilemma because there are two opposing values that we like, that we hold dear, that we appreciate, that are being put at odds within the question. And a good thing to do, especially with these questions that are kind of impersonal and not asking you about yourself, is to, one, inject yourself back into the question by using first person and actually talking about what you value and why as it relates to the question. And also that's kind of the point of these ethics questions in general, is to find out more about you and what you value and why. And it also kind of helps outline the main issues of the question without being redundant and repeating the question. And it also shows that these are both values that you care about. And even if you end up more on one side than the other at some point in your answer, you're not ignoring one of the values. So for this answer, for this question, I might say something like, I strongly value the dignity of this homeless community and making sure that they feel respected in the place that they live. It's really important to me that their safety is also preserved and that they aren't being left out in the cold without any means of heating themselves or cooking food. I also strongly value fire safety and community safety, and it's really important to me that both this community of homeless people, but also any surrounding citizens of Vancouver, are not at any increased risk of a fire breaking out, which could put them at intense danger. So what do you care about and why on both sides? Then I like to do pros and cons. So some pros of the radar, some cons of the radar. And in this case, the main pro of the raid is really fire safety. But one thing that you can do to make your pros list sound more considered and like there are more parts to it or it's a bit deeper is actually break it up into stakeholders and think about fire safety for whom. And that way your answer sounds a bit more considered. You don't actually have to like say one stakeholder is, another stakeholder is, but just as you're thinking and answering the question, these are things that you should put into your answer. So you might say something like, one pro of this raid is that it does actually protect the people in this homeless community from a fire breaking out. If a fire were to break out in one tent, it could easily spread to all the others, and that could be very dangerous for the people living in the community. This raid also prevented the people within the larger city of Vancouver from experiencing the negative effects of a fire breaking out. For example, if there were to be a large fire in this area, that would send smoke into the air and damage the air quality for everyone in the area, especially people living with lung conditions and asthma and related conditions. Another way that this raid was positive is that it did also protect the environment. We've seen a lot of forest fires happen in the Vancouver area and surrounding areas, and a fire that broke out on Sugar Mountain could easily spread to a forest and destroy a lot of nature and wildlife, and that's something that we do rely on, and I personally would like to respect. So I do see how this raid could have protected the environment in that way. So really, it's just fire safety, but broken up into different stakeholders and how it's fire safety for whom. Cons of the policy, you might want to include things like relationships between groups. So how was this raid negative for relationships between the homeless community and the government or first responders? I could imagine that these are groups between whom the relationship is probably already strained. And I imagine that the raid did not help things along. And a negative impact of the raid is that now people in this community may not trust first responders. And if they're in a situation where they need emergent help, they may not feel comfortable calling 911, which could be very dangerous for them. Also, it doesn't respect the dignity and well-being of this homeless community, both in terms of their health, but also in terms of their just personhood, to go into someone's home essentially and take away things that belong to them shows a general disrespect for that person's selfhood. And I think that was something that should have been considered in this case. There are lots of different things that you could talk about here in terms of cons of the raid, also like hypothermia, as Ariel mentioned in his answer, how this impacts the healthcare system in general. If people are left in the cold and without means of cooking for themselves, they might end up in hospitals, which might put a strain on the healthcare system. So that's something else to think about. Basically, who could this affect? To what extent? What are kind of some of the fallout consequences? Thinking about it in a broad way. And then you're going to say, because I value both value A and value B, I propose solution C. So the answers to these kind of either or ethics questions are never just, yes, the raid is justified, or no, the raid is not justified. It's always yes, but, or no, but, and here's something that could have been done differently, or here's a different solution. So in this case, it might be something like, because I value both community safety and fire safety and the dignity of this homeless community, I don't think the raid was justified in the way that it was carried out, but I do agree that something needed to happen to make sure that safety was maintained for everyone in the region. What I think could have been done differently was there could have been discussions with the homeless community and an attempt to have them actually hand over willingly their dangerous devices and gas-powered stoves in exchange for heated blankets and hot meals. And that way they would still be able to have hot food and to be able to heat themselves in the winter, but in a way that was safer and more respectful of them as people. I also think it would have been a good idea to perhaps also erect a new homeless shelter or have a soup kitchen open so that people didn't have had somewhere to go in the winter when it was cold. I think in general, we need to talk about addressing the housing crisis in Vancouver and making sure that we're investing in affordable housing for everyone so that we can address the root cause of homelessness in the first place, so that we don't have to worry about these dangerous devices in tents. Something like that. Okay, any questions about this before I go on to the next slide? Okay. I'm going to go on to the next slide. Okay, so that structure, as I mentioned, is only for questions where you have two options. I am briefly going to go over, let me just check the time. Cool. Okay, I am briefly going to go over a structure for how or what questions. It's very similar. You're still going to do a plan layout. You're still going to have your value statements. In this case, the value statements may not be directly conflicting. You might have 3 value statements, you might have 2, you might have 1, but I still want to know what you care about and why. And then I want a list of goals and how you would go about accomplishing those goals. So very quickly, an example of a question that you might get that looks like this could be something like, your friend is reluctant to get the COVID vaccine. Hold on, let me just check the chat. Someone's asking about a recording. Yes, it's being recorded and I will post it online. Okay, so let's say the question is something like, your friend is reluctant to get the COVID vaccine. It's now 2024 and they still haven't received their first vaccine. And now they are kind of considering if they should get it or not, and they come to you for advice. Plan layout, same thing. In order to answer this question, first, I would like to discuss my values and how they align with the problem at hand. Then I want to talk about some goals that I would have in approaching my friend, and then how I would accomplish those goals. Value statements. I strongly value autonomy when it comes to making medical decisions. It's really important to me that my friend doesn't feel coerced into doing anything to his body that is against his value system or something he doesn't feel comfortable doing. I also strongly value community health. It's really important to me that I'm doing my part to protect those most vulnerable in my community, people who can't get vaccinated and are more susceptible to communicable diseases, something like that. Goals are, what do you want to accomplish in this answer or in this scenario? And the goals should be pretty short. And by goals, I mean, what do you want people to know? How do you want them to feel? What do you want to know? Anything else you want to accomplish in the scenario? You can number the goals if you want. So something like, I have a number of goals that I'd like to achieve as I navigate the situation with my friend. Number one, I would want my friend to feel heard, respected, and validated throughout our conversation, and for him to know that I'm a safe person to talk to and I'm looking to respect his wishes and his values. I also want to know more about why my friend doesn't want to get vaccinated and what's preventing him from taking that step. And I want my friend to know more about the science behind the COVID vaccine and the evidence behind why it has been shown to be effective and safe. Something like that. Okay, after the goals, you're going to talk about how you're actually going to go about accomplishing those goals. You don't have to do it in the order you laid out the goals. You can do it chronologically. You can do it kind of in any order that comes to you. In this case, you're going to need some if-then statements because your friend is not there actually answering the questions for you. You're going to start by saying, I would start by having a conversation with my friend in a place that he feels comfortable in a time that he's not busy. I would start by asking a lot of open-ended questions and learning more about his perspective. If I were to find out that my friend is reluctant to get vaccinated because he doesn't believe the science behind COVID vaccines, in that case, I would learn more about his scientific literacy, what papers he's read. I might refer him to some papers, work through those papers with him, help him understand kind of the evidence-based research we have regarding the COVID vaccine, if that's something he's open to. If my friend lets me know that he's actually just very scared of needles and he is very reluctant to get this vaccine that's kind of optional at this point, I would let him know that I also have a fear of needles, but it was not that bad when I went to get vaccinated. I might also offer to go with him to a vaccination clinic to offer support, something like that. So kind of come up with a few different options as answers to your questions that you might want to ask this person and go down those rabbit holes and talk about what you would do in each of those cases. And then you can end off by saying something like, in general, if my friend does choose to get vaccinated and that's something he's able to do, in that case, I would definitely support that decision and help him out with that in any way that I could. If he decides not to get vaccinated, I would also respect that decision. And hopefully we can continue this discussion at a later point, and maybe he might change his mind in the future. But it's important to me that he knows that I'm always someone he can talk to if he has any questions about this and that we remain friends. Something like that. Okay. Next slide. Okay, common mistakes for ethics questions. We talked about a lot of these being too one-sided. One is relying on rules or laws rather than explaining your values or morals. It's kind of easy to say like, oh, there's confidentiality, so I actually can't say anything to the parent and I'm following the rules. I want you to explain why confidentiality is important to you and why it's a value that you hold rather than just relying on like, well, that's the rule, so I can't say anything. Just because something is the law or the rule doesn't mean that it's right. So you might be in a situation where you actually have to go against the law of a place or time in order to show your ethics or your morality in certain situations. Not presenting an alternative policy or solution. Always think about that option C. Not signposting your answers. We talked about that. Missing key stakeholders, ignoring patients. There are a lot of questions that are like kind of related to healthcare or related to clinical settings, but patients are not directly in the question. They're not saying like, a patient comes into your clinic, what would you do? Consider every question that you get about like medical school or hospitals or the healthcare system. Make sure you include patients as a stakeholder and put them first, because really that's the most important part of medicine is patients, also dentistry. Missing red flags and worst case scenarios. This is more for like situational questions, but I like to always think about like, what is the worst case here? Or if I were to do option A, what would be the worst possible outcome? What is the worst possible reason why this person could be in this position? Things like abuse. So if someone's in danger, when are you going to break confidentiality? If someone's safety is at risk, that sort of thing. Relying on bioethics buzzwords, words like non-maleficence. These words don't mean a whole lot. They're definitely not worth relying on. And also, I find that a lot of people who've read Doing Right and kind of apply these buzzwords to their answers kind of miss the point of the question, especially because most med school interview or dentistry interview ethics questions are not actually about bioethics. They're more about like social issues. And really, these 4 principles of bioethics only apply to bioethics. Autonomy is only relevant to bodily autonomy and medical autonomy. You don't have ultimate autonomy in the world. You can't just like ignore a red light. Your autonomy to do that is not really relevant. Also, I don't like first I want to gather more information. You're not going to get any more information from the interviewer or from the imaginary people in the interview. It's fine to talk about what information you want to get at different points of the structure. So if we go back here, one of your goals might be to know more about why this person is hesitant to get the COVID vaccine or something like that. But I wouldn't just reflexively say, first I want to gather more information, because it doesn't say much. Okay. Some red flags to never, ever, ever do. Don't blame other people, ever, ever. Don't put other people or professions down. This is a big one. You may not even realize you're doing it. Sometimes you get a question like, why do you want to be a doctor and not a nurse? Or something like that. And you definitely don't want to say, well, nurses are, not that smart, or nurses aren't involved in research, or say something that could be negative towards another profession. Don't be negative. We talked about that one. Never lie. Don't do it. I find that when people lie, I can usually tell, and also the truth is often a better answer. And don't be rude ever to anybody. That includes administrators, people you email, students, anyone you talk to in the process. Okay, opening it up to Q&As. Thanks for sticking with me for that long presentation. I'm just going to check the chat right now for any questions that have come up so far. Okay. Do you need to prove that you have these values? I value safe public health measures because of something you did on your resume. No, you do not. So the values are just things that you hold true or hold valuable to yourself. You don't need to prove that you have the value because of something you did. It's enough to say, I strongly value maintaining privacy and confidentiality for patients. It's really important to me that patients feel comfortable sharing any sort of vulnerable information with, in this case, me as a physician. And if I were to reveal that information, they may not feel comfortable doing so in the future. So preserving that is really important to me. I don't need to know that you actually have done that in the past. Another question, what if it was a situation where the vaccine was mandatory and your friend didn't want to get vaccinated? It depends. I don't exactly know what you mean by that question, but just because something, again, is the law or the rule doesn't necessarily mean that it's right. And what does mandatory mean? Does mandatory mean like in this country, in his workplace, something like that? There are always other options. So maybe he doesn't want to get vaccinated, but he needs to be vaccinated to work as a physician or something. He doesn't have to choose not to work. Like that's always an option. So that's something you could talk about. Even if it's mandatory to get vaccinated, it's not your job as a friend to coerce your friend into getting vaccinated. You can discuss the options. You can talk about pros and cons. You can help him make a decision, but it's not your job to say you need to do A, B, or C. Another question, how long does the average successful applicant study for MMIs? How many hours towards researching? So this is a good question. I've actually put up, I see a lot of questions, but actually on the next slide, I put up some questions that people asked in the sign-up form. And one of the most common ones was, what do I need to read? What should I know? What should I study before the interview? Do I need to know about current events? The answer to this is always, you don't need to read anything. You don't need to know anything. They're not testing your knowledge. They're not testing your knowledge of health systems. There's nothing you need to know. It's very similar to Casper, where you can't really anticipate what the questions are going to be. And if you happen to be knowledgeable on a certain topic, then that's going to help you. And it might help you get from like a level 4 to a level 5 answer. But they're not testing if you know what the law is regarding like HIV disclosure or prescribing birth control or anything like that. So it's helpful to like have a general understanding of how the healthcare system works, and the fact that we have a public versus private healthcare system, what you have to pay for, what are the issues regarding that, just like general knowledge that you would have from maybe being a patient or being a volunteer in a hospital, or just understanding how medicine works in general. But it's nothing that you necessarily need to study. And the more you practice, the more you'll see like different question types come up. And actually, I found that in most Canadian interviews, the questions are more social anyway, and not necessarily related to medicine, or like tangentially related to medicine. So it might be about like social media in medicine, or, having the number of teachers we have in classrooms, stuff like that, social issues. Sometimes they're about current events, sometimes they're not, sometimes it's something totally random. There's no way for you to guess what your interview question is going to be about. So I don't think it's worth spending that much time like studying current event and social issues. It's a nice thing to do in general. It might help you understand the world more, but I don't think it's the highest yield thing to do for interviews, or the thing you should spend the most time on for preparing for interviews. And in terms of like how much time should you study for interviews, when I work with students, I would say like if you can do once a week for a month with me and then practice on your own, like a month of prep, that's pretty good. Like you would be successful with that. Usually I do a package of 5 sessions with my students and then they kind of practice in between. The school that has in the past given you the shortest amount of time to prepare has been U of T. So they usually give 2 weeks from when they send out the invites to when the interview actually happens. Most other schools give you about a month or a little bit longer. 2 weeks is like the shortest time I would spend studying for the MMI. That's a pretty short amount of time. Probably a month is a good amount. You actually don't want to study for much longer than a month or be in like hard interview mode for much longer than that, because you kind of like need to have your answers on hand and ready to deliver. And it's hard to like be in that mode for a very long time. So like about a month is probably fine. And then like how much you want to like study or prepare per week is kind of up to you. Okay. I answered the one about ethics issues, preparing stories. How can you prevent yourself from sounding over-prepared and robotic? You practice and then you over-practice and you over-practice more so that you've practiced how to sound not robotic is my answer to that. Okay. Other question. I've heard that you should introduce yourself and thank the interviewer when you go in to answer a question. Yeah, I like that. For MMIs, I would definitely do that. Or in a panel interview, the first time you meet the interviewer, you should definitely say, like for MMI, you might just open a room or like go into the Zoom chat or whatever it is, and just have a person there and you're expected to talk first. And in those cases, I would definitely say, hi, my name is Emily. I'm really excited to be here. Thank you so much for taking the time to interview me today, and then answering your question. That always sounds good, not corny. Okay, other question. For a McMaster, we're provided 2 minutes to review the prompt, 8 minutes to answer. There are possible follow-up questions, but these are not asked. And if we talk for the entire 8 minutes, okay, so in 8-minute stations for MMI, usually you're expected to talk for about 4 minutes, depending on the school, and then you leave time for follow-up questions. You can't talk for longer. Some of them are like UBC is actually pretty strict on this. Like they only want you to talk for 3 minutes. McMaster has been traditionally more open-ended, but I would aim for like 4 to 6 minutes, like half the station should be your answer, something like that, and then leave time for follow-up. Okay, other questions. If you get, why do you want to be a doctor and your real reason is related to a sick relative that your journey with them has had a very significant impact on your life and decision to pursue medicine, is that really a mistake to say? It's not a mistake to say, but keep in mind that every question you get in the interview is an opportunity for you to prove why you would be a good fit for medicine and why you have the qualities that would lead someone to pick you out of the hundreds of students or thousands of students that they're interviewing. So I don't just want to know why you want to be a doctor, but also why you would be a good doctor. And it's fine to briefly mention a sick relative, but I want to know, if you're going to give me that story, what did you learn from that experience? What qualities did you gain from that experience that would make you a better doctor than somebody else? Okay. Do you have any suggested resources for question banks? Yeah, there are tons of question banks online. I have a list of questions that I use with students. I saw that question was asked by a student of mine. So when we work together on your interviews, you will have access to my whole question bank. But there are tons of question banks online that you can find. Generally, they're mostly good and high yield. Could you tell us where you served as a medical community manager? Yeah. Maybe I'll message you privately. I don't want to like out the school. Yes, Miriam, I'll message you about this because it's recorded. I don't want to give away all the secrets. Okay. All right, I'm just going to look at the questions that I have on my message me too. Just say it's somewhere in Ontario and it's not U of T or Mac. It's a different one. Okay. Okay, other questions on this list that I want to address. Can you ask the interviewer for clarification on the question stem if you're not familiar with the concepts being discussed? Absolutely. You can always ask for clarification if there's a person there. I know at U of T there isn't because it's just a video recording. But if there's a person that you can interact with in the interview, absolutely. If you need any clarification, always ask. How long should your answers be? Depends on the school. Usually they'll give you some guidelines for that. Generally about 4 minutes is average, somewhere around there. And what is the best way to approach interviews with a positive mindset rather than dwelling on the anxieties? This is a good question. Number one is prepare. The more prepared you are, the more comfortable you're going to feel, and the easier it will be to kind of fall back on your answers. The other way is some like mental tricks that I have. So one is understanding from being on the other side of the interview. I know that most interviewers are really excited to be there. They want to give you the benefit of the doubt. They want you to succeed, and they're invested in having great people join their school. And really, at the end of all of this, after you finish all your interviews, you're going to have a choice of which school you want to pick, mostly. I know some people only get one interview, but kind of like come along with me on this thought experiment. So at the end of all your interviews, you're going to get a bunch of acceptances, hopefully, and you'll have to choose if you want to go to Western or if you want to go to McMaster, whichever school that it is. And it's the interviewer's job to make sure that you pick their school because they want the best people joining their school. And if they send you an acceptance, that means they want you. So it's not only your job to impress the interviewer, it's also their job to impress you so that at the end of it, you pick their school. They want the interview to be a positive experience. So if you shift your mindset from thinking about like, here's my chance, my one shot to impress the interviewers, and think instead about here's my opportunity to understand if I even want to go to the school for me to see what happens in this interview, then it might take the edge off a little bit, or at least that's a mental trick that I use. Okay, I'm just looking at the text chat a little bit more. Do you feel like an asynchronous interview is more difficult? In some ways, yes. In some ways, no. Generally, the way you prepare is the same. I think different people have different preferences, but I guess it just depends on the person. If you get a choice to schedule your own interview slot, what's an ideal time to choose, later or earlier? It doesn't matter at all what time you schedule the interview. You will, I think for the most part, interviewers can go back and change, like an interviewer will see like 4 people in a day or something like that. And maybe you were the first person and you gave a really strong answer, but they were like, all right, that sounds fine, I'll give it a 3. If another person gives like a weaker answer and every other person gives a weaker answer, and then they decide that actually your answer was stronger, they can go back and change it. So it actually doesn't matter where you go in the day, all is equally good. Do you know if U of T's video recording format is through Zoom? Are the questions still personalized? It's usually through Kira Talent, and the questions are standard for the day. So everyone who has an interview that day will get the same 4 questions. Do you have more availability to take on more students to coach this MMI cycle? Yes, I do. I have lots of availability. The cycle like hasn't fully started yet. Some schools have sent out invites already, but for the most part, we're still waiting to hear back from a lot of the schools, which means I'm still waiting to hear back from students and people who are looking to do interview prep. I'm just going to post my information up here so you guys can see it. Yeah, so all of my packages are up on my Instagram page. Generally, I offer a package of 5 sessions for $750. So it's $150 per session. Each session is an hour long. In those sessions, we would do a lot of practice questions together. So I would have you answer a question in whatever format your interview is in. Then we would talk about what number grade you would give it, talk about what it would take to get that question from a 2 or a 3 to a 4 or a 5. And then we would work on building those star stories together. So taking your star story, thinking about what we can add to it or what we can change about it to make it really strong. Same for like ethics policy questions. Just so you guys know, I've posted my contact info here. You can email me. I sent out the Zoom link via my email, so that's a good place to reach me. Also, my Instagram page is at AG Med Prep. I do CARMS prep also, application editing. I have Casper courses, interview prep. Yes, I just saw that post. Yes, I do offer CARMS interview prep also. In fact, most of my students right now are CARMS students because med school interviews hasn't come out yet and CARMS interviews have come out. So yeah, I definitely do CARMS interview also. If you can only do a few sessions, yes, totally. Yeah, if the price is too steep for you for like that number of sessions, definitely message me and we can work out some kind of option that works for you. Someone asked, when will you start taking students? Right now, I'm taking students right now. Dalhousie interviews have already happened. So like I've already done Dal interview prep, UBC is happening right now. You can wait until you hear back from a school. If you want to start earlier before you hear back, you can totally do that also. I don't think you need to start before you hear back from a school. You can definitely wait if that's easier for you. But if you happen to be keen and you want to start earlier, you definitely can. I'm going to say something else and now I forget. Yeah. Cool. People are still asking me about where I was an interviewer, and I'm just gonna put up. This is Ariel's where he was. Ariel went to med school at Western and I was living in London, is the clue. Yeah. Oh, also, I wanted to mention, I do offer a free, not free, a $50 30-minute intro session. So, and that is refundable if you choose not to sign up for further sessions. So if you aren't sure if you're going to hear back yet from a school, but you want to like get some early prep in, or if you just want to see how I give feedback and how I would personalize my feedback to you, you can sign up for a $50 30-minute session. And then if you choose not to sign up for further sessions after that, I'll refund the full $50. And if you choose to book more sessions, then we can just book more sessions. Any other questions? All right. So thank you all for joining me on this January evening for our workshop. If you have any other questions after the fact, you can always message me on Instagram, email me. All my contact information is up there. I will be happy to answer any questions personally via direct messenger or anything like that. I will be posting a recording of this afterwards, so I'll post it in my link tree on my Instagram page. You can like click it and watch the recording. Yeah, it was nice to kind of meet you all via the Zoom chat, and hopefully we'll get to talk again soon. All right, have a good night.